Hi, welcome to the session. In this, we're going to cover the topic of heart attack and explain how heart attack happens and what are the conditions associated with it. The heart attack occurs when the blood flow begins, or rather brings the oxygen to the heart muscle, is drastically reduced or stopped. In such an eventuality, a heart attack happens. And because the coronary arteries that supply the heart with blood slow out as the arteries become thicker and harder due to buildup of the plaque, that's basically the fat and the cholesterol, and of course other substances contributing, this will result in the plaque. And this slow process is defined as atherosclerosis, and this forms the foundational element. And the more the choking of the arteries happen due to the blockade, that would essentially lead to the heart attack scenario. If the plaque breaks open and a blood clot forms, and that blocks the particular blood flow in the artery based on how narrow it is, again, this results in the heart attack as well. So this gives a perspective of the different scenarios how heart attack is going to occur. So it is important for you to remember that the coronary arteries supply the blood and the oxygen to the muscles of the heart. And in case there is an impediment in delivering both these things, of course, it has a serious medical condition for the individual. The plaque buildup, how does it happen? The fatty deposits, which are called essentially plaque, build up into the inner arterial walls of the coronary arteries. As this plaque builds up inside the arteries, as we see, the first is the result of atherosclerosis, and as this happens with the time, and the fat deposits which essentially have cholesterol, calcium and other substances that are found in the blood, and due to the high blood pressure and high sugar, these are again couple of leading contributors or attributing factors for the atherosclerosis condition to occur. And so it is primarily important not only just analyzing the plaque buildup, but what are the contributing factors and how to avoid them. This is the best possible shot you can give towards eliminating that heart attack type of condition. So the topics that need further research and investigations include at what point and how the arteries become damaged. So it's hard to assess because the location is different, the size, shape, and the plaque formations are different. So there's a lot of studies being done, and I think with the time that is coming through as I see on the technology curve, so interesting lab studies are happening, and once it is translated from the animal studies towards the human studies, I think down the line you could have many new technologies that could detect the plaque formation into the inner walls of the coronary arteries. Moving ahead, how does the plaque contributes towards developing and changing over time? Of course, with now the nano-enabled cameras, for example, such a study is possible in the near future. Why does the plaque rupture and lead to blood clots? Again, this is item of further study and investigation. Though we know the rupture will result into either blood leaking or clot formation based on different conditions there, but how does it weaken, how long does it take, what kind of impact that this have, that needs to be further investigated. So it's important for you to remember that the fatty deposits called the plaque build up in the inner walls of the coronary arteries, and which is not a warranted situation or need. The other symptoms or the risk factors that need to be assessed would include if the plaque significantly narrows or blocks any the arteries, then the ischemic heart disease is a resultant of that, and very commonly it's called angina. And this leads to first as a chest pain, severe chest pain happens, and the individual would realize that it's choking in their lungs, in the chest essentially, or there is a severe discomfort that occurs when the heart muscles don't get enough of the oxygen rich blood. So this situation is it could be a mini heart attack or minor heart attack or a major one. The degree of variance will be based on the blockage and the artery, the location, and of course the common denominator. There is deprival of the oxygen rich blood. Angina, when it occurs, an individual may feel there is a pressure and very squeezing sort of feeling in the chest. So obviously this is compelled due to the shortage of the oxygen rich blood getting to those parts of the arteries. And you may also know that even some of the people would experience the shoulder, arms, neck, jaw, or back. They could feel a pain or uh, some sort of numb factor there, and the angina pain may even feel like indigestion for some of the people. This is only experience that's narrative, but one has to feel and realize that condition. But these are some of those visual cues or signals that help you potentially identify, and any urgent care visit to the doctor is the mandatory way to go about so as to mitigate any of the potential risks that are coming through. So going further, as the pain tends to get worse with the activity, if someone is performing, then the strain plus the activity strain would compel them to basically stop the activity and rest immediately. So this emotional stress can trigger further pain as well. So one needs to take immediate care and at least get relieved from that particular activity so as to ease and not put additional pressure on the emerging medical situation or the condition for the individual. So as you see, if the plaque becomes unstable and the ruptures happen, the clotting process called the thrombosis starts inside the artery. And looking at the ischemic heart disease, this will be visualized in terms of the shortness of the breath for the individual and the cardiac arrhythmia situation. So it's cardiac arrhythmia where the pace of the heart would increase obviously as the arteries get narrower. So a lot of blood has to rush through that smaller real estate area. In turn, the high BP is triggered, and as a consequence of that pressure you have the cardiac arrhythmia also, which can be detected with the heart rate sensor for example or through the ECGs. The cardiac arrhythmias are problems with respect to the rate or the rhythm of the heartbeats. And when plaque can also form into the heart's smallest arteries, then this type of disease where it is into the very smaller arteries, that situation is basically defined as the coronary microvascular disease, in short MVD. What are the symptoms for the coronary MDV condition? This would include angina. Number two, the shortness of breath. This is very obvious. And discomfort in sleep, essentially sleep problems would be there, and lack of sound sleep, or the REM sleep as we call it, is one of the proper factor to assess. And fatigue, the tiredness the person would experience, either tired or very tired or fatigued, and that's also a indicator, and that risk factor also needs to be assessed. And lack of energy, of course, through using the RMDs, that's basically the wearable type of devices, IoT enabled for the healthcare. You could detect even the energy levels, whether it is normal energy or whether the individual is tired or fatigued. Thrombosis. So as you see, the thrombosis essentially is the formation of a blood clot, which is referred as thrombus, and it happens within the blood vessels, and it essentially prevents the blood from flowing normally through the circulatory system. And when a blood clot forms in the veins, it is also known as the venous thromboembolism. And this can cause deep vein thrombosis. It's a DVT in short. It's a medical condition that would warrant immediate attention by the specialist. And likewise, you have even pulmonary embolism as well. And when a clot forms in the arteries, it is called atherosclerosis, and which can lead to a heart attack and a stroke also. So as the thrombosis continues, the blood supply to the heart muscle is reduced, and the muscle tissue then starts to die. So this is a serious situation in the making. So one has to have an understanding. So the best option would be to immediately rush to the hospital or the medical attention, uh, either ambulance or the EMT, whatever appropriate next steps that need to be taken. So deep vein thrombosis. This DVT condition occurs when the blood clot forms in the major vein, usually in the leg. This is just an example. And this blood clot stops the blood from flowing through, basically through the rest of the vein, and which can lead to swelling, discoloration, and pain in the leg. These are all the visual symptoms that individual could experience, and are indicated. So the more you are informed, the better it would be to immediately react to the situation and prevent major conditions or any adverse event happening. It is often diagnosed with ultrasound. So the immediate next step would be to rush to a urgent care center or a hospital where such ultrasound could be performed. And with the modern advantage of technologies, you have even mobile ultrasound imaging also, and such type of conditions can be discovered even in the villages, in the rural health camps, for example, or in the diagnostic centers as well. When a blood clot forms within the veins, this condition, as we have mentioned, it's a venous thromboembolism, and this can cause the deep vein thrombosis or the pulmonary embolism. It often starts basically with the DVT condition, and as the piece of the blood clot can break off, and it would get carried to the lungs, and then with the PE can block the flow of blood to the lungs, causing serious damage to the lungs and affecting a person's ability to breathe. So the shortness of breath and the squeezing of the chest, these are all the symbolic conditions that one could assess very quickly. And this can lead to serious injury or even worst case death events as well. So one need to be very cognizant and react almost reflexively or at the earliest, so as to avoid any such adverse potential adverse scenarios. As the thrombosis continues, this would again give less of the oxygen to the heart muscle, and which in turn, what do you say, the tissue or the muscle tissue to be precise, it can start to die. That's why the earliest intervention is the way forward and potentially saving the person. The leading causes of the myocardial infarction: if the clot completely blocks the coronary artery, then all the muscle tissue below the blockage can die. So this is one such situation. And then the dead cardiac muscle tissues can lead to myocardial infarction. As you can see, the dead cardiac muscle tissues is the myocardial infarction, and if the clot completely blocks the coronary artery, all the muscle tissues would below the blockage can die, and discoloration is the visual sign through which it is detected. And of course, a person has to go through intense pain, shortage of breath, and fatigueness. So these are all the other conditions that can be quickly analyzed. So this gives you a perspective of the several risk factors and the causes and the attributing factors that are contributing towards the heart attack. So for more information or to download, you could visit the website and get to the information. Thank you very much for your attention and look forward to see you again. Thank you.